So we've got all the heavy hitters. We've got the people with the knowledge, the people that are driving this effort here to hopefully answer as many of your questions as possible. I've also invited our hospital and healthcare government affairs representatives to be here today to listen in on the call. We have a tremendous amount of respect for our medical staff and the hospitals who have been putting in countless hours, dealing with the COVID patients, ever since inception 2 months ago when this virus started. So we're going to get this going. I'm going to not talk so much. We're going to try to get to as many of your questions as possible. Nick Mascione is going to give a brief overview of the San Diego COVID-19 vaccine rollout. And then we're going to have our county experts answer as many of the questions that they can that you submitted as time permits. We're going to keep this to 1 hour. So Nick Mascione, are you on and live and ready to give a presentation?
Good morning, Supervisor, and thank you, Supervisor Desmond, for helping organize this town hall. As the Supervisor mentioned, we have a brief presentation by our experts here at our county COVID emergency center, and we want to give you some of the background because I think that'll address some of the questions, but then also provide some of the insights that might lead to some additional questions. So we are going to jump right in. And with that, I'm going to get to our presentation, and we'll start with Dr. Denise Foster. We'll talk about how the vaccine is arriving here to San Diego. Dr. Foster.
Yes, good morning, everyone. Thank you so much for being here today. On the first slide that we have in our presentation, it talks a bit about the vaccine allocation. It kind of maps out the process. So it starts with the federal government, with the Centers for Disease Control and Prevention, the CDC, and they make the allocations to the states. And that's somewhat based on population as well as rates of COVID and a number of other factors, and readiness to be able to deliver the vaccine. Then once it arrives in the state, so the California Department of Public Health has it now, they distribute it and allocate it to the counties and other entities, healthcare entities, pharmacies, etc., based on those groups signing up as providers. And they have to sign up through the state as a provider, which goes then to the CDC to be approved as official providers for this particular vaccine. This is a process that is specific to this vaccine. Once you've been approved as a provider, then they take a look at what you say you need based on your population you want to serve, and what your capacity is to store and administer the vaccine. And then this report comes to the county, and then we give the final approval on those allocations, and then those are sent to the entities to be delivered. Once that happens, as they get the vaccines to say the hospitals or pharmacies or even our county public health sites, we then have storage requirements, and we keep those there. I think all of you are aware of the ultra cold storage requirement for the Pfizer, so the specific freezers for that, as well as the storage for the Moderna is also very specific as well. So there are various groups who receive the vaccine. I think it's really important to know that there's these federal entities, and they get their vaccine directly through the federal government. And so, for instance, many of you have heard that the long-term care facilities have signed up with a partnership with Walgreens and CVS. So Walgreens and CVS are receiving their vaccine directly through the federal government and then administering it in the long-term care facilities, skilled nursing facilities that have signed up under that program. There's also the military, and then there's also other large entities that have signed up. And then, again, I mentioned that you have to be a approved provider. We call it COVID ready, enrolled provider to receive the vaccine directly and to even manage the vaccine indirectly. And then there's also what we call multi-county entities. So this multi-county entities, you may have heard all these terminologies, are a big hospital program, so like, for instance, Kaiser crosses many entities, many counties. We also have the UC system, the University of California Health System, which they have hospitals throughout California. There's also other big programs, big hospital systems in Northern California, like Sutter that you would see. And then we also have us, the County of San Diego, as you see. We receive the vaccine directly. And in some cases, we distribute from our, through us to smaller entities. So some of the smaller hospitals or pharmacies or independent physician groups might be in that group as well as we also have our regional public health centers that will be receiving vaccine through us as well.
Good morning, everyone. I wanted to let you know, first of all, how the phases and tiers were determined. Nationally, there is a group called the Advisory Committee on Immunization Practices. This group advises the CDC. And so these determinations about phases and tiers were determined using scientific data, as well as looking at what was happening around the country with COVID-19, determining risk groups and vulnerability based on that. These recommendations then came to the state of California, where our California Department of Public Health had two groups, the drafting guidelines group as well as a scientific review group that reviewed the data and looked at the information that was provided for the tiers. They were able to then formulate these specific phases and tiers for California. So phase 1A, all of phase 1A, we are vaccinating now, and phase 1A currently is healthcare providers, personnel, healthcare workers, as well as any employees and residents that are in long-term care facilities. Phase 1A is split into 3 tiers. So the first tier includes all of our acute care hospitals and psychiatric hospitals, as well as skilled nursing facilities, long-term care facilities, and assisted living facilities. This includes all of the residents that live within those facilities. Additionally, paramedics, emergency medical technicians, and other emergency medical services are included in this first tier. Dialysis centers and behavioral health residential facilities. Tier 2 is intermediate care for persons who need non-continuous nursing supervision. This also includes home health care workers and in-home supportive services. Community health workers, including promotores that are going out into the community. Public health field staff, primary care clinics, federally qualified health centers, rural health centers, correctional facility clinics, urgent care clinics, and outpatient behavioral health facilities. Tier 3 includes all specialty clinics, laboratory workers, dental or oral health clinics, pharmacy staff that are not working in any of the other facilities that are mentioned in Tier 2 or Tier 1.
Could you go just back over, because this is very important, the prioritization. And I know you read it already, but if you could just read it again, because this is very, so I could go over this one again. See it. Thank you.
Thank you, Supervisor.
Absolutely. Again, there is phase 1A, which we are currently vaccinating, and this includes all healthcare personnel as well as residents and employees of long-term care facilities. This phase gets broken down into 3 tiers: Tier 1, Tier 2, and Tier 3. In Tier 1, there are a number of There are a number of groups, including our acute care hospitals and acute psychiatric hospitals, skilled nursing facilities, paramedics, emergency medical technicians, dialysis centers, and behavioral health residential facilities. Tier 2 is further broken down into immediate care for persons who need non-continuous nursing supervision, home health care and in-home supportive services, community health workers, including promotores, public health field staff, primary care clinics, federally qualified health centers, rural health centers, correctional facility clinics, urgent care clinics, and behavioral health outpatient facilities. For Tier 3, this includes all specialty clinics, laboratory workers, dental and oral health clinics, as well as pharmacy staff that are not working in the higher tiers. On the next slide, I'd like to let you know about the county's COVID-19 vaccination clinical advisory group. We have 3 tri-chairs for this group that are individuals that work from around our community and region. There's Dr. Gail Knight, who's the Chief Medical Officer at Rady Children's Hospital. She's also the co-chair of the Hospital Chief Medical Officer COVID-19 Advisory Group. Myself, as well as Dr. Rodney Hood, who's the founder and CEO of the Multicultural Health Foundation, a physician at San Ysidro Health Center, and a member of the California Governor's COVID-19 Vaccine Task Force and chair of the San Diego County COVID-19 Equity Task Force. This group is made up of 26 members who are all clinicians or physicians or nurses that are working here at the county and in the community. So we have a local partnership with many of our community counterparts who represent organizations and populations of including vulnerable areas, some of the hardest hit areas by COVID, and as well as groups that take care of the elderly, as well as certain other populations that we want to make sure that we include in vaccinations. The goal of this group is to determine fair and equitable vaccine distribution for San Diego County.
Before we go to the next slide for implementation, and we're almost done, I'd like to go back, if we may, to the previous slide. There, please. Dr. Kadocta, can you also explain, this is where we are today in San Diego, as approved by the state. We are all focusing on these tiers of phase A, the health area. It's approximately over 500,000 people right now that we have to get to and vaccinate. I know there's a lot of questions as when do we get to the other categories professionals. So if you can talk briefly, Dr. Kadocta, about what follows this and the sequence of phase 2B, and just briefly describe that, and then we'll go right into implementation and then get to your questions.
So just for your understanding, there is a phase 1 and a phase 2. So phase 1, we're currently in 1A, but it's actually broken into 3 sections, A, B, and C. And each of these sections has its own tiers. I reviewed with you what phase 1A tiers are. For the majority of folks on this call, you will likely be in phase 1B or 1C. So phase 1B does include essential critical infrastructure workers in various sectors, including education, food and agriculture, as well as seniors that are 75 and older. Phase 1B is broken down into 2 tiers. So that was the first tier I described. The second tier will be 65 to 74-year-olds, and then additional sectors of essential workers that are in critical infrastructure. Phase 1C will be next, and that is also 16 to 64-year-olds who have underlying medical conditions or disabilities that place them at higher risk for contracting COVID. And again, there are some critical infrastructure sectors that are involved in 1C as well for those essential workers.
Thank you. Jennifer, can you talk about implementation? If we could move to the implementation slide, please.
Sure. So as you heard, today we're vaccinating people in groups in phase 1A, tier 1 through 3. So to do that, there's a couple of different ways that you could possibly, if you fit in that group, get your vaccination. So you can always contact your healthcare provider to see if they are able to vaccinate you. It's always a good first step. If your healthcare provider cannot vaccinate you, or if you work in a doctor's office or some other medical setting, your employer may be able to vaccinate you. But if not, we're working on setting up regional points of dispensing. We currently have them in four regions: the North, East, South, and Central. We are working to set up more. We're with partners and our community partners and our hospital partners, and we're looking at how can we set up more pods, is what they're called, to be able to make sure that people have access if they fit the correct tier. For long-term care facilities, there's a federal government contract with CVS and Walgreens to vaccinate those who are in long-term care facilities. To augment that, we're working with our partners to set up rapid response teams to be able to go out and try to get to our over 1,200 facilities as quickly as possible. We're also working on making sure that each tier, as we go through them, will have access as a safety net to any of our pods, whether they're located in a small community setting or a larger setting, to be sure that we can reach out and have fair and equitable distribution throughout the county.
So just, we know we covered a lot of information and there's probably a lot more questions. We have a website where all this information and more is provided at our www.coronavirus/sandiego.com. And we put that information there to identify not only the tiers, but try to demystify, as the supervisor said, to provide just the latest information that we have available. In addition, one of the things posted there is our actual plan. This is a multi-page document requirements we had from the state of California that we submitted in early December, which really identifies our work in following the tiers and the sequences and working with all our healthcare partners. So with that, Supervisor, I will turn it back to you.
So we sent this information out for this town hall. We got over 800 questions. And so what we try to do is consolidate them down, and we're going to try to get to at least the top 20 of the questions, because there's a lot of many duplicates. So we're going to do our best to try to get as many of these questions answered as possible. I also see a lot of questions are coming up in the chat. Know that if we don't get to your specific question today, we're going to try. My office is going to try and do our best to get you those responses. But most of the questions I can see are when am I going to get mine? When is that going to happen? And I think that the best thing is, go to the website and find out, look at that prioritization list. If you can't find yourself or you're not sure, contact my office. We'll be happy to do that. But first question, Nick, for your team, there was how has, and you've addressed some of this in the presentation, but maybe some more specifics, how has San Diego structured the vaccination process? And this primarily is to how are people going to be able to get the vaccination? Thank
you, Supervisor. Great question. As it was mentioned, the vaccine arrives in multiple channels, as Dr. Foster mentioned. I'll speak more primarily to the county's role. For the county's role, we are working with our healthcare partners, including our own public health, making sure we are rapidly getting vaccine so that the healthcare partners, i.e. hospitals right now, are getting and vaccinating all of their employees within healthcare. We are also now working closely with cities, vaccinating the paramedics, because as Dr. Kadakia mentioned, that is a high priority group. The importance of the paramedics and emergency response is that paramedics are allowed through the state of California to also administer the vaccine. So we're trying to build that workforce, if you will, upon receiving the vaccine, so that we have the ability in cities throughout the county, including CAL FIRE. In doing so, the federal government also plays a role in the state. The federal government is using CVS and Walgreens, the two pharmacies you may have heard that are actually under contract and getting vaccine and are reaching out and have started already in vaccinating skilled nursing facilities and long-term care facilities. We are also going to be helping in that process, because we're going to try to accelerate those long-term care facilities, because for us, it's the speed by which we're trying to get these vaccinations out. But there is that effort happening through the commercial pharmacies. Then there's also vaccine, very importantly noted by Dr. Foster, that some of Kaiser Permanente, they have 620,000 covered lives in their health plan, in the Kaiser plan. They are getting vaccine and they are also administering it, but they're following the tiers, the requirements of the state. So they're taking care of healthcare, but a fair number of, for example, teachers or law enforcement or transport or grocers or governmental workers all have Kaiser. Kaiser is going to be coordinating that directly with them. That's also the other plans, Sharp Health Plan. So you have the vaccine coming in many levels, and very importantly, San Diego is a military and veteran town, and we're proud of it. about 1 million San Diegans are active duty veterans and families of active duty and veterans. They get their own vaccine separately from the Department of Defense and the federal government. So our military, Boa Naval Hospital up in Camp Pendleton, they have begun vaccinating their active duty members. The VA has been reaching out now and starting to vaccinate their veterans. So it is happening in many levels. We did not design it this way. We wish we would have had all the data. We have some of the data that comes in and some of the data we do not have access to. But the issue here is the urgency of getting through phase 1A right now. So we're protecting the healthcare providers so we can quickly get to, as Dr. Kadakia said, that phase 2B, which is the other professions and other priority groups, so that ultimately we can even get to the general population. So that is the big structure, our plan, in great details on our website.
Well, and I guess just as kind of a follow-up, the next question is who, I'm sorry, just to kind of follow up on that and you know, as part of that question, next question is, who is the vaccine being distributed to in San Diego County? And when you mention like CVS, you know, people just can't walk up to a CVS right now and say, hey, I want the vaccine. They're being administered to certain functions. So who is it being distributed to now in San Diego County?
Yes, thank you, Supervisor. I'll take that question. Right now, we have quite a large number of facilities that are receiving the vaccine. So let's start with our big hospitals. So we've got our acute care hospitals and including our psychiatric facilities throughout the county. So, you know, I'll say Tri-City and Palomar and up in your region, and as well as, you know, all the Scripps hospitals, Sharp, et cetera. And then we also have a number of retail pharmacies who are now approved as providers. So the pharmacies at Vaughn's or Ralph's or many of those others, as well as what we discussed around the CVS as being a kind of a mega pharmacy site. And we also have a number of our clinics, community clinics throughout the region who have been approved as provider and are receiving vaccine. They've been vaccinating their healthcare workers, and they are also vaccinating other healthcare workers that reach out to them for vaccine. Then we have, of course, the public health has received vaccines as well, and we've been vaccinating our public health team, especially those nurses and physicians and others who will be vaccinating. So we can get our vaccinators vaccinated first, and we want to get them trained in being in doing that as well. And then with that, there's a few private physician groups that also have applied for provider and are distributing and administering the vaccines.
And Supervisor, to your point also, at some point, once the retail pharmacies have taken care of the skilled nursing facility long-term care, then we are hoping, and I say hope because we don't know that definitively, but that they will then be offering the vaccinations like they do the seasonal flu at the pharmacies, that they would be doing the same. But that's until they get through right now in prioritization with those high-risk groups with the skilled nurse facility and long-term care.
And yeah, we have provided guidance to them around the tiers and who they're open to be vaccinated at this point in time.
All right, well, I'm glad to hear the tiers are being followed, but to somebody, just kind of a follow-up, if somebody's a Sharp or a Kaiser, you know, they're in that program, in those healthcare programs, and knowing that they're getting the, you know, the Sharps and Kaiser are getting those, the vaccinations, what should somebody who's a subscriber to one of those healthcare services do?
So if you are a medical worker, say a nurse or physician, and you don't work for that organization, but you have your insurance through them, best advised to reach out to your provider and see if they have the availability of the vaccine. If they don't, we encourage you to come to our county site and sign up to receive a notification on where to get your vaccine.
Well, thank you. Moving on, one of the questions was, why are vaccinations going slower than expected?
I can take that. I just want us all to be mindful. The first phase 1A, as we've said, is 500,000 individuals that we need to vaccinate who are high risk because they're providing care to others. And then, of course, a total population of almost 4 million for San Diego County. So while we received the vaccine only about 3 weeks ago, we're working on just building mass vaccination and building the infrastructure in order to vaccinate everyone. We want everyone who wants to be vaccinated to get vaccinated, and of course, in a reasonable manner. It's just simply building up that infrastructure to handle the volume that we need to in order to vaccinate everyone. But I guarantee you we're moving as fast as we possibly can and working with our local health partners in order to make that happen.
Well, I appreciate that, and I know it's hard, and we're only getting it, so fast, and we can't really control other providers of the vaccines that they're getting in San Diego County. So the other question, you've sort of answered it, is, let's say, okay, your number's up, your tier comes up, and that you're in. Where do people go then to get the vaccine? Since it's at different places, how will they know, or where do they check to see, okay, I'm eligible now to get it? Where do I go?
Jennifer, would you like to?
Sure, I can take that one. So there'll be numerous places where people can go. We're setting, like I said earlier, we're going to set up regional, we have set up regional pods for people within phase 1A to be able to be vaccinated. There's on our website, there's a place that healthcare workers can go to sign up to be notified when their tier comes up, which is right now, and they will be sent information about how to sign up for one of our regional pods. In addition, because healthcare workers may work for an entity that can vaccinate them, they should be checking with their employer to be able to see if their employer is going to vaccinate them. As we move forward, we will have pods in every region. Again, some very large, some smaller to reach different parts of our community that may have difficulty with transportation or other needs. And so there'll be pods in every community. We hope, as we go forward, we expect that people may be able to also go to their own provider, whether it's Kaiser or Sharp or whatever, wherever their own doctor may be, to get the vaccine, but we will be there as a safety net or a place for people to go if they aren't able to get it from their own medical home.
And Supervisor, I know we're using really new nomenclature, and for the general public may not. I know we talked about pods. It stands for points of dispensing. It is a location where we're doing vaccination. So these pods that Jennifer just talked about, they're at our Live Well centers, there are literally at facilities. You will be hearing into near future how we are going to have different type of pods, whether you go into and go get an indoor pod, a drive-through pod. This is very much like we did for testing, for T3, for our test, trace, and treat, where we then identified where the need is, and we built out areas for some people that need to stay in their cars, people that want to walk in different aspects of the county. But the priority is we're starting with 4, as Jennifer said, but increasing them significantly through county and our partners throughout the entire county, literally in weeks to come.
So, but if somebody, like I said, would they go to this county's website to find out, I guess, where they can go to? Maybe it's one of the many pods, and that's going to be listed on the county's website. People know that, and that the one that you displayed earlier, and we will blast out. Also, I just want to mention in the chat, if you've noticed, we've been putting in there the contacts for Script, the contacts for Kaiser, and the different health providers in San Diego County in the chat there. So if you need to get that as well. What next question that came up is, can I sign up for a vaccine? Do I have to put my name on a list? And if I do, where is it? And can they even sign up at all, or you just wait your turn? How's that work?
So currently, we are only vaccinating phase 1A, which are those healthcare professionals, healthcare workers, long-term care facility residents, and employees that work in long-term care facilities. So currently, the vaccination is only for phase 1A, which includes all those healthcare workers. When we get to phase 1B, this will be messaged to the public in order for you to know when to go to a vaccination pod. We do have a registration system, and then there will be information on how you would be able to attend one of those. And additionally, as we're building up with our local partners, there will be clinics. Your local physician will have the vaccine at their vaccination site, pharmacies again, our vaccination pods, as well as local hospital systems.
Well, I guess kind of a follow-up to that, and part of the next question is, you mentioned a registration system. So that sounds like something you sign up for. So, and I guess the next question is, how will a person be informed that they're eligible to receive that vaccine? Is that through that registration system? And if so, how do you get, where do you register?
Jennifer?
Sure. So right now we have on our website, there's a place for healthcare workers to be able to sign up to receive notifications that they are able to be vaccinated, with a link to our pods currently. As we go forward, we will be messaging to the public as tiers come up in different ways, whether it's through the community, through our news networks, through all sorts of different ways that will allow people to know it's their time to sign up, and there'll be links for them to be able to do that.
So potentially, if they do sign up and they register, then they'll be, if they're in tier whatever 2B or whatever when they may fall in, that they'll be, I guess they could they possibly be emailed? Is that how the registrational work system works?
So currently, yes, that's what's happening for our healthcare workers. They sign up on our website, and they receive an email with the link to our pod to be able to sign up for a vaccination.
I get it that that's for the current tier. So is that going to, I guess, be opened up? Is a lot of the healthcare workers and into the population? Is that going to change then, so then the population can sign up for email notifications? Or are you only going to do that for the healthcare providers? And I'm not judging. I'm just trying to
Sure. So right now, because it's such a specific group of people, we're doing specific emails out to the people that fit in phase 1A. As we move forward, we'll have other ways that people will sign up, including if anybody's been to any of our testing sites, we have a robust system for them to be able to know where and when the testing sites are. So we'll probably have, we anticipate having something similar to that when the general public needs to get vaccinated, if they're unable to be vaccinated by their own medical doctor. I don't know if anybody has anything else to add.
Yeah.
Well, and I know we're hitting you with some pretty hard questions here, and you're just getting your feet, just getting up and running on this whole thing. So I really appreciate all the efforts that going through it. Just, we're trying to, respond to just kind of the frustration out there. But thank you for the hard work you're doing. Well, the next one is more specific, is how will a small private practice office give the vaccine to their medical staff offices, that they're not attached to a major institution like Scripps or UCSD or Kaiser? How does a small private doctor's office get the vaccine and disseminate it? Have you gotten to that point yet? And if so, what's the process?
Yes, Supervisor. There's a number of processes in place, and it sort of depends on the size of the facility. For very small offices, it might be advantageous to have them come to one of our pods and sign up with the notification that Jennifer just referred to, and be able to go through one of our regular pods. If they're a larger facility, some of our medical groups have hundreds of employees, for instance, we can work with them to set up a possibility for them to administer the vaccine, with the caveat that we have to manage it. Because going back to earlier in the discussion, there's very specific processes for obtaining the vaccine and storing it. And so you have to be registered to receive it and store it. However, we have our own staff that have been able to support larger groups like that.
Okay.
So And then there's always a possibility, again, if they, there's certain hospital groups that have partnered with their physician groups that are in their catchment area.
I'm also just going to add in that on our website, on the coronavirus website, the first thing you see when you get to our coronavirus website is COVID-19 vaccination. If you click on that, it leads you to a page that has a link for healthcare professionals. There's lots of information on that page. But additionally, we created a form called the COVID-19 Vaccine Notification Form. This is for those practices, those healthcare providers who are not able to be vaccination sites themselves, but that they need to be immunized. They fill out this form for themselves and their staff. We receive that, and we have a database that we keep. And when we are within their tier, which we currently are, we contact them by email so that they can make an appointment to sign up at one of our vaccination pods to receive vaccines.
Okay. The next question is, how will a business, and I noticed some of these tiers related to different businesses and industries, how will a business be notified about the vaccine rollout to their industry? I mean, for a particular business. Yeah.
Great question. Besides the, what we share at our weekly press events or press releases and how we're using media outlet channels and social media, county website, more importantly, one thing we did unique to San Diego in our COVID response when we declared the emergency on Valentine's Day of last year is we created what they call these affinity or sector groups. And this was following our Live Well San Diego model. And so we created a business group. We created a local government group. We created a faith-based group and healthcare groups, lots of different groups. And fortunately, there has been very active participation, Supervisor, by your district, the chambers of commerce in your district, the economic development councils, all of those business sector groups, if you will, we used in the early days of the response of what to do to protect themselves from COVID, using all the non-pharmaceutical interventions about wearing a mask and physical distancing and staying home, you're safe, and if you're ill and so forth. It is the same groups we use then for testing, pushing out our information on testing. It is the same outlets we'll be using and pushing out information around vaccine. And so we have kept those groups, and that has been a very collaborative, very important collaborative effort, and one that, again, we're unique to San Diego that we'll be using as a force multiplier of getting chambers and others to push out the message. In addition, Supervisor, to your own updates that you provide into your district. So those are all the channels we use. We will make sure we saturate this message so no one is left without understanding when it's their turn.
Well, and thank you very much. I'd be happy to incorporate those messages in getting the word out to people when they can get their vaccine. So this next question is, we just kind of collated all the questions and took the most, the duplicates that we had together and collated them. But well, this one you've already kind of answered. It's, will the public be receiving weekly updates from the county regarding the specifics of the administration of COVID vaccine? I don't know, is there anything more specific you want to add? But I think you've already answered that question.
Yeah, Supervisor, I just want to underscore, please go to our website. That's where we're providing updated information all the time of what's happening. And so again, that www.coronavirus-sd.com. I know you put the link on your updates as well. So that is the source we try to direct everyone to, because it's the county source and where we're getting information directly from the federal government and state, as well as our own work that we're doing here in the county.
All right. Well, our next question is, when can essential workers get vaccinated? I guess this is the whole
Okay. Yes. Again, essential workers, most essential workers will fall into phase 1B or 1C. Those are the next phases that are going to be vaccinated after phase 1A closes.
I know there's a lot of question of when. Give me a date. I wish I could provide that. Where we are right now with phase 1A is that we know we have weeks still of a pretty large group. And we're vaccinating 7 days a week, as many groups that we can possibly do. Upon, several more weeks, clearly, to get through this, When we're getting close to the phase B, it's not we're not gonna know we're getting there. We're gonna begin to message in advance. So this is, again, we're not gonna slow down and then start. We're gonna do concurrent, because the idea here is to quickly vaccinate as many San Diegans following this kind of sequence. But it's not for several more weeks at this point, for sure.
Well, and thank you. The next question is really, how will vaccines get to people who are homebound? They can't get to the doctor's office, or they're homebound. How are we going to administer vaccines to them?
Jennifer?
Sure. So we're working right now with our partners to develop a way for us to send medical personnel to people's homes if they wish that and they're homebound and can't be able to go to one of our pods, to be able to, if they can't get to their own doctor or their doctor doesn't have the vaccine, to be able to go to them to administer the vaccine in their home. So that, as we move into the next phase, particularly phase 1B, where over the age of 75 may be needing a vaccine and they can't get out of their homes, we'll be working to make sure that we have medical professionals that can go to the home to make that possible.
Dr. Foster, too?
Yeah. Hi, and we also are partnering with a number of our hospital groups throughout the county, and so looking at how we can mobilize resources from, our hospitals do a lot of healthcare as well as our clinics, and reaching out to homebound or mobile limited individuals so they can get the vaccine. And we have specific groups that this is what they do on a regular basis, is go to visit, do home care.
And Supervisor, one big group, as a program we do in the county, in-home support services is a priority area. That is a group we're looking to get and doing that in reach to, because these are folks that are typically medically fragile, living at home, being helped by others, and we got to keep them safe as well as their caregivers. So that's just one example of a program, in addition to the CVS and Walgreens going to the skilled nursing facilities. They are a priority, and that's why they're in the phase 1A, excuse me.
1A, okay. Well, this is kind of getting now into questions more about the vaccine itself. What are the common side effects?
Right.
I can take that one. Common side effects, this vaccine is similar to if you've had a shingles vaccine. There are similar side effects, or the other vaccine I equate it to is a tetanus shot. So sore arm is a very common complaint, as well as redness where the injection was given. Some other side effects include headache or feeling tired, having some muscle aches, or maybe a fever. Those are the most common side effects. Of course, we do know that there are other side effects that can happen with any vaccine, and these are rare. But of course, we are doing observation after someone receives the vaccine. And when you come to get vaccinated in a pod, you would be observed for at least 15 to 30 minutes, so that we make sure that you did okay with the vaccine. And of course, if there are any complications or concerns about side effects, we'd want you to speak with your primary care physician.
All right. We got quite a few questions and not a lot of time, so I'm going to kind of go through them a little bit quicker here. It's, how long does it take to build up immunity? So if I get the shot, or I get the vaccine, and I get the second one, how long till you're safe, or whatever, how long does it take to build up the immunity once you're vaccinated?
So currently we have 2 vaccines available to us, which is Pfizer and Moderna. Pfizer, with both doses of vaccine, each are 2-dose vaccines. You need 1 dose followed by a second dose about a month later. So with Pfizer, it's about 95% effective, and with Moderna, it's 94% effective. But even with just your first dose of vaccine, you do build immunity around 50%. And when you have your second dose, then it's, back closer to that 100%. Immunity, shortly after receiving the vaccine, usually you start to build some antibodies within 7 to 14 days.
All right. Well, will people have a choice to take the vaccine or not?
Yeah, Supervisor, I'll take the vaccine. Which vaccine will people have a choice of will depend on where they go. So we're not going to be, people will not be able to select which vaccine they get the first time.
But with their second dose, we want them to get the same vaccine that they got with their first dose. So if you get Moderna with your first dose, you're going to get Moderna with your second dose. But you won't have a choice of which vaccine you're going to get.
Well, and this one kind of follows up with that. Is the vaccine mandatory?
No, it is not mandatory. We highly encourage people to get vaccinated, but it is not mandatory.
Okay. I just asked this question myself. How many people, to get, I don't know if the term is herd immunity or to get the best effectiveness, what's kind of the goal that we need to get to?
Well, we obviously want to have as many people as possible get vaccinated, but usually herd immunity is around 60 to 70% of the entire population being vaccinated.
Okay. Many seniors are out there in my district, and can you provide any criteria or classification as age as it relates to phases? So I guess the first phase, for seniors, 75 and older, and then can you kind of explain briefly how the age, I'm 64 and a half, so I don't know if that counts, but the, can you get clarification on age? Okay.
Yes, Supervisor. For phase 1B, that's 75-year-olds and up. So everyone who's 75 and up would be vaccinated in phase 1B. And that, again, that phase is broken into 2 tiers. So the second part of that in phase 1B is 65 to 74. For phase 1C, it's 50 to 64, or 16 to 50 with a disability such as a medical condition that makes them more at risk for contracting COVID.
Okay. Well, this is a question I think you've already answered it. Will there be multiple vaccination sites to deter large gatherings and large lines? I'm sure you're going to put as many sites up as possible.
Yes.
And then how about as far as the locations, communities like Borrego Springs? Is the public going to have to travel, if you're in Borrego or Valley Center or some of the unincorporated areas, are you going to provide vaccinations out to those outlying areas as well?
And the answer is yes. And just like we did very proudly with CAL FIRE, who have paramedics, they did for testing, we will be doing the same for all of our backcountry area, Supervisor, in your district, as well as in Supervisor Anderson's district in East County, and working with the clinics also in the backcountry area as well.
Okay. Let's see. Another one is, are vaccination sites going to be walk-in or drive-up, or both?
They're both. They're going to be both. We want to try to be make it as convenient as possible for folks.
I just kind of backing up to the distribution thing. We hear news reports of Florida, even they're giving it out to anybody over 65. They're already doing that. And I know we talked about the pace and everything. And we're following the CDC guidelines here in San Diego County. I'm just trying to have everybody understand, because we hear different things from different states doing. Can you just kind of reiterate how our rollout is being managed? Is this the county's decision, or the CDC's, or the states, or who's come up with this plan following?
Yes, Supervisor. We're following CDPH, the California Department of Public Health, but those guidelines are based off of the CDC. So these are strictly CDC guidelines. California, with the groups that they established to review those guidelines from the CDC, then made some determinations that included all of the CDC guidelines and then included some additional sectors, like some of the essential workers that are classified into 1B and 1C. Okay. But it is CDC plus CDPH.
Okay, all right. News reports in some countries, not counties, countries are delaying the second dose. Is there a priority for the second dose as compared to a first dose? So we want to, I realize we only have so many vaccinations, and after about a month or whenever the second dose is to be applied, how is that being managed? But I guess within the people that are in the next phase, it's going to be kind of hard to, I guess, disseminate. Can you talk a little bit about how that prioritization of the second dose is going to be handled?
The second dose is prioritized. We're not holding back vaccines, so everything that we have now, we're vaccinating now. with the understanding that we are receiving vaccine weekly, so we continue to have allocations coming in to be able to give those second doses. So nothing has changed in our guidance that we wouldn't provide the second dose. We will still provide that second dose.
Okay, we've got a couple more. One of it came from a registered nurse. She said, "Can I volunteer to help give out vaccines?" He or she said.
Yes, Supervisor, absolutely. We encourage all licensed professionals who can give the vaccine within California. So physicians, nurses, paramedics, dentists, there's a few others on that list. And student nurses, student pharmacists, pharmacy techs, paramedics,
Dentists.
and dentists can give the vaccine. They've been approved to do so, and they can sign up with the Medical Reserve Corps, which is a process by which they can be vetted, so they can vet their licensure, and they can volunteer, and we will put them to work giving vaccines with the county.
Their website is www.healthcarevolunteers.ca.gov.
Can you repeat it one more time?
www.healthcarevolunteers.ca.gov. That will link them to the Medical Reserve Corps. Great.
Okay, one more. I guess we only got time for one more question, then I'm going to wrap this up. We're getting a lot of comments on chat, and maybe it was a little bit confusing here. A lot of the comments about they're going right now to the county's website, and they're looking for a place for them to register. My understanding from your answer was the only people that can really register right now are people in I guess phase 1A that are health providers. So when their tier comes up and potential, I guess, so could you kind of re-explain the process? And where people can
Sure.
I apologize, Supervisor. I lost you there for a second. So the way that people, yes, the people that can sign up right now are healthcare workers. And so there's a little healthcare section, and if you're a healthcare worker, you can sign up there, and we will be sending you information. Everybody else will be getting, as we head to phase 1B, we'll be putting out information more robustly to be able to make sure that all of those people who fit into phase 1B are aware via our website, via the media, all sorts of different ways to make sure that they're aware of how they can sign up for a vaccination. So we haven't gotten to that point yet because we want to get through phase 1A as quickly as we possibly can. And we want people who are eligible to sign up so that we can move through that tier as quickly as we can.
Well, okay, so right now they're not going to be able to sign up as unless their tier is open and available. And I know this is very, you're working very hard and fast and furious and doing the best you can. It might be just a suggestion if people can, if you could expand it to where people could sign up even though their tier is not available, to get at least get or something like that.
Yeah.
Trying and you're doing the best you can, but that might be a suggestion so people can kind of have that assurance knowing that they're in the system.
Supervisor, we are actually working on that. There is no such application that's been provided by the state. We're developing that ourselves, and we will have it well in advance before we get into tier B, 2B. But you are absolutely right. We need to make sure it's somewhere we demystify like this today, but we have a place where everyone can go, can register, and then know when their turn's up, that they get notified and where to go. That's exactly what we're working on, and we'll have up shortly.
Well, and if I could add something with that too, Supervisor, they'll also receive the notification with this application about their second dose.
Oh, okay. So that's good. That's good to know. Once you get those. Okay, I want to say thank you very much in closing. Thanks to all of participation, to Nick Mascione, to Dr. Kadakia, to Dr. Foster, to Jennifer Coons, to Anita Walia, for your time today and taking these questions. We had quite a few of them, and I really appreciate the time that you've taken this morning to do that. I want everybody to know that my staff is available anytime, to help at all. If we don't know the answers, we'll find somebody who does. My office number is 19531. 5555, District 5, 619-531-5555. My email, I'm not going to read it out. You can go to the Wood County's website. It's a pretty long email. But I want to thank everybody who signed up today. And if your answer did not get brought up, or I'm sorry, your question did not get brought up, we will, contact my office. We'll try to get your specific answer, your specific questions answered if we didn't get them today. We are going to be emailing out to everybody who signed up the top 20 questions that I went through today. I will also include additional helpful information. I'll post the Q&A on my Facebook and website. You can rewatch this later. But I know these are trying times and everybody wants to get the right answer. So if you didn't get your question asked today or answered, contact my office. We'll be happy to help guide through that process. Thank you, everyone who signed up. Miles, is there anything I missed on here or something?
Oh, sorry, my fault for the little glitches during the presentation. We'll send the presentation out as well. And just thank you to the staff and everybody else for coming on. Thank you.
Thank you very much, everyone. Hope we may do this again in different things, but I appreciate everybody participating, and thank you and stay safe.